Nitra made a huge splash yesterday, announcing $187 million in financing across its Series A, Series B, venture debt, and warehouse facility, bringing the company's total capital raised to $205 million and total equity raised to $90 million. Here to give us some additional context on the company and the raise is co-founder and CEO Tim Hwang. Welcome to HTN and congrats on the raise.
Yeah, appreciate the time, Martin.
So, for people unfamiliar with the ins and outs of a provider's back office and financial operations, can you talk us through the opportunity that you see here?
Yeah, just taking a step back, obviously, I think what we observed when we were founding Nitra ultimately was that the administrative aspects of healthcare were really spiraling out of control. And I know everybody talks about that, and any kind of periphery conversation with a provider, inevitably ends up with, I hate all the different tools that I'm using. I can't believe I'm on the phone with this insurance company. I don't know where this spiral of money is going down the drain. To the kind of medical supply distributors, and I don't know why this particular drug is so expensive, or so there's like a whole host of administrative and financial things that are very, very painful for providers. And so, in kind of the opportunity that we see here is that, as the healthcare industry overall, which today is going to be totaling about $5.9 trillion a year, is really, starved for tools to be able to help them assist in terms of automating the back office, identifying savings, and really creating kind of technology platforms that assist in those challenges. And so that's why Nitra exists. We have a very, very big and very clean mission at Nitra, which is to help doctors save time and money. And every single tool that we do, every single product that we create, ultimately comes down to how do we create technology that helps providers and doctors save time and money. And that's really the opportunity that we're kind of going after today.
Makes a lot of sense, and it seems like it's really resonating in the market. So the financials shared in the press release are super impressive. Great revenue growth, 700 clinics, processing a billion in annualized transaction volume, looking at 4 billion this year. Can you talk a little bit about the business model, how you sort of go in and partner with these clinics, and what sort of results you're seeing as you do?
Yeah. So our product, just to be clear, is free for clinics and practitioners. There's very, very little friction to adoption. I always tell doctors, I talk to doctors almost every day. You know, there is absolutely no reason for you not to try our product. It's completely free. If you don't like it, you can just not use it in the future. Um, so the way that we make money is sort of one of three ways. So the first is, we monetize through transaction volumes in terms of people using our cards, our bill pay, all of our kind of payment solutions specifically for paying vendors or, you know, um, distributors like McKesson or Medline or Cardinal or Syncora. And so, it's not any different from how, let's say, like Amex or Capital One or, JP Morgan Chase is kind of monetizing on that end. Um, the second way that we generate revenue is we have an internal marketplace in our business. So people can actually buy, medical supplies and pharmaceuticals and whatnot directly from us. Our pricing is directly competitive with all the major kind of distributors and whatnot in the market. In fact, we've actually already partnered with McKesson and Medline and a bunch of others to be able to be, licensed distributors there. And there we actually earn an incremental retail margin. So, no different from if you walk down the street to Home Depot or Walmart and just bought a pair of gloves or whatnot. And so that's sort of the second way that we generate revenue. And then the third way is in very, very limited cases, like in our AI patient scheduling software or our inventory management solutions. Those involve a lot more intensive sort of software integrations. And so we charge for some integrations and kind of software components there. But overall, like, by and large, the expense management platform, the accounting software platform, the inventory marketplace solutions are all free to providers. And we often see, pretty enhanced savings for providers who are using and engaging with the platform overall. And then I would say overall, like we have seen very, very little churn, once people kind of get onto the platform overall.
In the press release, it noted that you're embedding AI agents directly in the workflow. I'm curious to hear what those AI agents are up to and what that's unlocking versus the sort of current state of the world for folks who are not on Nitra.
Yeah, well, we try and make AI agents very, very, very useful to both practice administrators and to physicians. So it could be as small as categorizing expenses by category or by procedure or by office location. Though that saves practice administrators especially hours and hours and hours of time every month. It could be as simple as accounting reconciliation or expense reconciliation. So agents that do all of that work. Um, Increasingly, for instance, we have two agents that I'm happy to talk about. One is around inventory, and so when you're going out and buying massive amounts of Avastin or nitrile gloves or syringes, are you getting the best price? Are you going to be clicking around and hunting through different vendors and the like? Are you negotiating on an appropriate basis? So we have and are continuing to develop a whole host of inventory agents. And then most recently, we launched an AI agent that does patient scheduling and eligibility checks using voice AI agents that you can sort of directly plug into your practice and save yourself quite a bit of time, essentially, answering the phones and be able to sort of handle, rescheduling, rebookings, eligibility questions, and some very basic medical triage as well, for our customers.
Looking back through your old press releases, I'm curious about the journey that sort of, or the evolution of the business that led you from launching with the business card to where you're at today.
Yeah, no, I mean, I think we've always viewed the kind of business card and the expense management tools as really a great introductory opportunity for us to work with our customers. Very low friction. It's pretty much as simple as like the next time you enter your credit card number on McKesson, maybe, let's try, Nitro once, and see if it works and see if you like it. We do all the reconciliation on the back end and whatnot. It's so in many cases, it's pretty life-changing already. But then, people start going down the rabbit hole of everything that we provide. And, um, you know, as we started with the credit card side and the expense side, um, we started just looking through our data, and we saw that people were buying a lot of equipment from, the McKessons and the Cardinals of the world. And so we started offering those directly. And then we saw, as people were doing that, that they were doing specific things that were just really repetitive, right? Like it could be, okay, well, before I pull the trigger on buying, this batch of medical equipment, let me just go through and check, these other, vendors, and let me just reach out to this rep just to see that I'm getting the best price. And so all of that can be automated. And we've essentially kind of built out these individual software tools to kind of help and assist with that. So we're really trying to listen to our customers and, we're kind of following along in both the data as well as the qualitative conversations in order to really inform our product roadmap and the work that we're doing, moving forward.
I can only imagine that if you're an independent doctor, this is great news. Like you're like, oh my gosh, I instead of having to, think about selling or like it's just enabling a lot of opportunity for a doctor who wants to run their own business.
Yeah, I mean, I think that, in other parts of the sort of small and medium-sized business world, like there's been a lot of venture capital, going into assisting restaurants and construction development companies and very very big companies have been built around that, right? Companies like Service Titan, Toast, Procore, but in the healthcare space, really, I think there's been this approach of like point solutions, and so there's a point solution for revenue cycle management, and there's another point solution for patient payment processing, and there's another point solution for, patient scheduling and rewards and loyalty. And I just think that it's really overwhelming, for somebody who just wants to see patients and, to run a good business off of that. And so I want us to basically get to a point where we become real partners to our providers and can really help them in assisting their back offices overall.
Okay, so say I'm a doctor and I want to learn more. What's the best way for me to learn more about Nitra?
Yeah, well, you can just go directly on nitra.com. It takes maybe a couple minutes to sign up, and it's pretty simple. So we're happy to have those conversations for sure.
Great. Thanks so much for your time, Tim.
Yeah, thanks a lot.